As a former director, can you talk about how late budgets and operating under continuing resolutions, continued budget uncertainty affects the readiness of the military health system?
When I look back at, in fact, I'll go back in history because I was part of that. When we initially stood up the Defense Health Agency in response to the perception that we had a 10% of the 10% of the DoD's overall budget, and then we moved. And then I fast forward to 12 years later, and now we're actually less than 10%.
Hey everyone, welcome back to the channel. Today, we're diving into how budget cuts are affecting military healthcare services. Senator Sen.Jeanne has been vocal about these cuts and their impact on military families. Let's get into it. Let's start with an overview of military healthcare. The Department of Defense operates a vast system for service members, veterans, and their families. This includes routine checkups, surgeries, and mental health services. However,
Senator Shaheen.
Thank you all very much for being here today. Dr. Robb, you discussed the impact of declining budgets on the Defense Health Agency. As a former director, can you talk about how late budgets and operating under continuing resolutions, continued budget uncertainty affects the readiness of the military health system?
When I look back at, in fact, I'll go back in history because I was part of that. When we initially stood up the Defense Health Agency in response to the perception that we had a 10% of the 10% of the DoD's overall budget, and then we moved. And then I fast forward to 12 years later, and now we're actually less than 10%. And I look at, we were meeting most of our, not quite, but most of our demands back then. But as I've watched, we've had increasing combatant command requirements with a decreasing defense health program. And what that has forced us to do is we've seen a couple of challenges, and there are multiple things going on, but the military departments have, their end strength has gone down. And the way we man those hospitals is with a certain percentage of military members. And as Dr. Friedrich said, you just can't buy healthcare professionals off the streets. And so when we cut the end strength, okay, then we apportion this care downtown, and then that increased TRICARE budget, which then we have to pay with Bag 1 money, which is direct care money, to pay direct care. So now we actually have a internal shrinking of our budget. So it has been challenging for the Defense Health Agency to manage a set of military treatment facilities with that to be the current business process.
And is it
yes.
fair to say that budget uncertainty exacerbates that problem?
Oh,
Continuing resolutions exacerbate
absolutely.
that problem.
Yes, ma'am. Yes, ma'am.
Thank you. Dr. Friedrichs, you mentioned the National Guard. And one of the things that I know that the National Guard, as we all know, is assuming a greater role in actual deployments and picking up work for the regular military. I could probably say that more eloquently, but they're taking on a much bigger role than they did 30 years ago. And yet the National Guard doesn't have the same coverage for health care that our regular military does. Despite the challenges that you all have identified, it's even a greater problem for the National Guard. Can you speak to what we ought to be thinking about as we're thinking about how do we ensure that the Guard actually has the health care they need so that they're ready to go if they're called to deploy or called into combat?
Thank you, Senator Shaheen. And I'll start, if I may, first with your premise that there's an increasing demand signal. The decision to take down the United States Agency for International Development and most of its capabilities is almost unquestionably going to drive more demand on the Department of Defense. USAID provided countless services for disaster response and for work with allies and partners around the world.
And for global health.
And for global health, and for biosurveillance and many other roles. In the absence of USAID, we either agree that when Americans are caught in a disaster, they're on their own, or we're going to turn to the only other organization that has those kind of capabilities, and that's DoD. So we should I'm afraid, expect to see more demand on DoD as a result of those changes. To your point about healthcare preparedness, when we look back at why people shortly after deployment have to be pulled off the line, interestingly, it's dental care, primarily among the Guard and Reserve, who don't have ready access to that. I think if we are serious about a smaller force that must be ready on a moment's notice, we are going to have to address how to ensure that force is ready when needed to go forward. And that's medically ready as well as ready and proficient with whatever their assigned task is.
And we're learning a lot of lessons on our industrial base side from the war in Ukraine right now. And a lot of lessons about the conduct of war today. Are we learning anything about the healthcare system and what we ought to be thinking about from what's happening in the war in Ukraine? Anybody?
If I may, I'll just quickly say, having just been with the Ukrainian Surgeon General, absolutely. So what they have found first and foremost is they're in the kind of conflict we will likely be in. In the absence of air superiority, contested logistics, you must have a functioning system that's integrated. And this gets back to Senator Fisher's question about the National Disaster Medical System. They're also learning the importance of supply chains. When we looked at this at the Joint Staff, we found that a significant percentage of the pharmaceuticals in our deployable assemblages actually rely on ingredients from countries that may or may not be willing to continue to provide those in the next conflict. Same song, next verse with medical equipment. I urge you, as I said in my written statement, to require the department to give you an accounting for our vulnerabilities in that area and a plan to address them. There are ways to do that. We need a strong push, I would submit, to actually accomplish that.
Thank you very much. Thank you all.
Thank you, Senator Shaheen.
Imagine returning from deployment and finding it harder to access medical services, or a veteran needing consistent care, facing skyrocketing wait times. These budget cuts could create real challenges. Reduced access can delay treatment for injuries and PTSD. So what can be done to prevent this from getting worse? Military health care needs to be prioritized in budget discussions. Senator Shaheen calls for more funding to ensure service members and veterans are not left behind. We can all get involved. Contact lawmakers, raise awareness, or support veterans organizations. Advocate for the health care our military personnel deserve. If we don't act now, the consequences could be dire. So that's the situation with military healthcare services and the proposed budget cuts. I hope this video sheds some light on how these cuts could affect our service members. Don't forget to hit subscribe and turn on notifications. Let's continue the conversation in the comments below. Thanks for watching and see you in the next one.